Hi, I'm Jamie for Survival. I'm here to tell you how to treat someone who has ingested or come in contact with poison. Poisoning can occur in the following ways: ingestion through the mouth, inhalation, fumes in the lungs, absorption through the skin, or injection, drugs, or venomous creatures. Signs and symptoms include abdominal pain, nausea, vomiting, or diarrhea, profuse sweating, unconsciousness, seizures, or breathing difficulties. First up, check your surroundings are safe, especially if toxic fumes are involved. You don't want to end up with two victims. If necessary, move the victim to a safer area. Check for consciousness. If unconscious, call 000 immediately. If unconscious and breathing normally, turn them onto their side, clear, and open the airway. If unconscious and not breathing normally, begin CPR. Take note, if there's burns around the mouth, wipe the area clean before commencing. If the victim is conscious, call the Poisons Information Centre on 131 126 and follow their instructions. These are some helpful tips to help you effectively manage the situation. If the poison is ingested, get the victim to wash out their mouth and spit it out, and also wipe around their mouth with a damp cloth. If the poison is inhaled, move the victim to fresh air as soon as possible, as long as it's safe to do so. If the poison is absorbed, remove any of the contaminated clothing and wash the affected area under running water. Now, if the victim can do this themselves, it reduces the risk of contamination to you. If the poison is injected, identify the substance and call 000. Be aware of any sharps. Take note of the time of incident and the type of poison. Don't give the victim anything to eat or drink unless you are told to do so by medical experts.